Well, hello there. This is Mark Idelman, speech-language pathologist, and welcome to the teaching of talking. This particular video is going to be about something very, very, very important, and very important for everybody. Now, when a person has aphasia, when a person has apraxia, you want to, of course, make the best decision. Make the best decision about the therapist, the method, make the best decision about the frequency of therapy, the intensity of therapy. And many, many, many caregivers have never had to deal with anything like this before. And so when a person has a stroke or aphasia, it's quite a shock. They don't know much about aphasia. They don't know how it's treated. They don't know how long it takes. They don't know the type of therapy that's best. And so therefore, they are very dependent on information. And information is very, very, very different in accordance with where you are and what your resources are. Now, there are many who, before they make a decision about therapy, want to check with their doctor. They want to check with a number of resources, and that's always a good idea. But just know that if you want to know the prognosis for recovery, the best person to get that information from is somebody experienced with aphasia and someone who has treated it and has a good history of working with people with this condition. It would not necessarily be the best decision to check with people who are not professionals in the line of speech. So if you have a question about speaking, and you have a question about prognosis for recovery of speaking, I mean, you could ask your dentist, you could ask your family doctor and neurologist, but they're not going to give you the most accurate information because they don't practice it. They don't deal with it, really. They deal with what they deal with, and they're experts at what they do. So if you want an opinion about a prognosis or about the type of therapy that's required or the intensity, you want to make sure that you go to the appropriate professional who can sit down with your loved one and evaluate their speaking and determine their level of speaking, and they can also determine the prognosis for improvement based on the tests that they give. Now, neurologists, regular doctors, they don't really have a way of knowing, okay? All they know is that they've seen patients before, some recover, some don't. And some recovery, and much recovery, depends on the intensity and the type of therapist they have, and the type of therapy they have, and the intensity of therapy that they get. So that has a lot to do with it. Not everything, though, because there's some who spontaneously recover, but they tend to be in the minority. And if a person has aphasia or apraxia, the best decision always is to start a form of treatment, because you never really know. You never really know how much speech is going to recover or not. But a therapist can tell you what their prognosis is and how easily stimulable they are. And once you know that, then a plan can be developed to help along the progress so that it occurs faster. And so the individual gets up and running with their speaking just as soon as possible. So, in answer to the question, how do you determine the best prognosis if a person has aphasia? The best way to determine it is to go to the professional who knows more about speech and more about aphasia than anybody else. And that's the person, the speech pathologist, who has worked with it, who understands it, who knows how to test for it, and knows how to improve it. This is Mark Edelman, speech-language pathologist. If you've liked this video, kindly give us a thumbs up. And please subscribe if you feel so inclined to do so. And also below the video are many resources for those of you who want to learn more about aphasia and who want to learn the types of therapies there are. And if you want to just get better educated about aphasia, we have a host of information and knowledge that have been collected over 46 years of clinical experience. And you can learn a great deal by taking the time to do your due diligence about aphasia, learn about the treatments and who's doing them, where they're being done, and the schools of thought about it. And this is a perfect way for you to become an educated consumer and decide the most appropriate interventions for your loved one. This is Mark Edelman, speech-language pathologist. Thank you for stopping by, and we look forward to seeing you again. Bye-bye now.